Hello friends, this is Dr. Jayshree Todkar, laparoscopic and bariatric surgeon. Today we are going to discuss about the new medications for the treatment of obesity. What is new in that and how it works as against the traditional proven treatments. So, obesity is one part which can really hamper our physical, psychological and social health, as well as it creates a lot of hamperment in terms of our performance physically, psychologically, sexually and by all means. Typically, obesity is a chronic disease and it needs treatment which is a long-term treatment. Along with dietary restrictions of the calorie, physical activity to get better muscle and better calorie burning capacity. This is not complete if the metabolic system of the body is not healthy. These two will work only if the metabolic system of the body is healthy. When not in health, we have to give support of scientific treatments. So there are two types of scientific treatments available. One, medical treatments, and the second, surgical treatments. Over centuries, medical treatments have shown hardly 10 to 20% of the result in control of the disease or in reduction of the weight on the long-term basis. Typically, the gut hormones try to resist the medical treatments by creating a set point where body will try to fight against the medicine and come back to the higher weight always and always. Finally, in the last century, science could reach a very strong, significant, successful and a sustainable solution for the disease of obesity and multiple other associated diseases, and that was bariatric surgery. Bariatric surgery is not removal of any kind of fat from the body, but bariatric surgery is the one which is done on the stomach and the small intestine. These typically form a kind of orchestral system for the absorption of the nutrients, assimilation into the body, creation of energy, and utility for the organ function. This orchestra can be modified with these operations, and these are known as the bariatric operations. Sooner with time, we got to understand that yes, these operations can also treat the multiple diseases which are associated with obesity, that is diabetes, high BP, high cholesterol, fatty liver, infertility, thyroid problems, joint problems, spine problems, kidney, liver, heart, and all these problems can get corrected to a great extent once these operations are done. So out of the operations, when the science is studying the mechanistics of how the operations work, we came to know around 50 plus various chemicals in the form of enzymes and hormones which get modified after these operations. So particularly the medical world and the science started going after these outcomes, these chemicals, and try to find whether external medications or pharmaceutical drugs can really give us a similar result. To some extent, they are successful. So maybe out of the 100 chemicals known which get modified after bariatric surgery, some 10 to 20 chemicals can get modified with the help of medications also. But particularly unless and until the body's resistance level for the treatments comes down significantly, these modes of treatments or modules of treatments do not give you the fantastic outcome as compared to the bariatric surgery. There are some medications which have arrived which can be used in people with diabetes, central obesity, or with pre-diabetes and obesity patients. These are various types of medications. One of them is the one which, when we take along with the food, doesn't let your glucose get absorbed completely. So partially glucose gets absorbed and the rest of it doesn't get absorbed. That helps you control the calories to a certain extent. There are some medicines which don't let all the fat get absorbed by the body. So typically, when we take these medications along with food, the excess fat in the food gets thrown through the stools, and instead of getting absorbed, it gets out of the body. There are other medications which also help the lesser absorption of the calorie and the fats and the sugars. And there are some medications which help processing of the calorie or the fat or the sugar in the body in a faster way. These medications were heavily under trial for last few decades. Now they have arrived, and in a certain number of patients, yes, we are able to use the medications to help them come down with the diabetes and the weight. But particularly, as compared to bariatric surgery, they will give you a result which is probably around 30 to 40% equivalent to that of bariatric surgery. And again, the medications need to be escalated with the doses as the time runs away, because as you take the medication, body's resistance also comes up. Also, there is a certain level beyond which you cannot increase the dose of the medications, and there you need to stop because of the adverse events that can be caused because of the heavy doses. And the third part is, above a certain level of medication, there is nothing which is available which can really help the patients to cover the rest of the factors which cannot get controlled with these medications. So typically, as we have understood, 4 modalities of treatment exist. Number 1, dietary restrictions of calories. Number 2, physical activity to burn more calories and to lessen the resistance by the body. Number 3, a few medications which can help up to a certain BMI only, up to a certain extent, up to a certain time. Typically, BMI between 26 to 30 will be the right choice for these medications, and above the BMI of 32.5, even the medications tend to not help to a great extent, and that is the time when surgical solutions offer you the maximum outcome to come out of this problem of obesity and multiple other diseases. So if you are suffering from obesity, you can consult us at the given numbers, and we can give you the right scientific solution how to get rid of obesity and the other diseases. Thank you.